Hello, I'm Dr. Alan Wolfelt, and I'm honored to serve as Director of the Center for Loss and Life Transition, located in Fort Collins, Colorado, and Scottsdale, Arizona. Thank you for joining me for this introduction to the companioning model of grief care. Early on in my life, I discovered my calling, and that was a desire to care for my fellow human beings in grief. As I look back, I understand that the origins of that calling have been anchored in my own life losses. So I don't think it's by chance alone that the words of Robert Bly have always spoken to me when he observed that your greatest gifts often come from your wounds. Yes, I experienced some wounds of loss, and out of that came a mission statement that I wrote at age 16 that still exists to this day for our center. It's simple, but yet in many ways, I think it speaks to the heart of our efforts to help. And it reads as helping people help others in grief. I also discovered early on in my caregiving life that I wasn't drawn to treating my fellow human beings in grief. In contrast, I was drawn to what I went on to term a companioning philosophy of caring for my fellow human beings when they encountered life transitions along the path. I've dedicated my professional life to advocating for my companioning model of grief care, and I've been humbled to have the opportunity to teach the tenets I'll introduce here, not only in North America, but the invitations I've received from around the world have been heartwarming. I need to also acknowledge that I'm proud of my 13 years of university education. However, I also need to acknowledge that most of what I was taught in academic psychology was very much anchored in a medical model understanding of grief. I was taught to assess, to diagnose, and to treat. My experience was that the medical model of grief care was not only inadequate in caring for people in grief, but I found it, in fact, often harmful. You see, according to the medical model of psychological theory, grief can be considered an illness that, with proper assessment, again, diagnosis, and treatment, can somehow be cured. That has never fit with my experience because I believe we care, we don't cure. My professional disagreement with this model of caregiving gave birth to me becoming what I term a responsible rebel. Well, what is a responsible rebel, you might ask? I believe it's one who questions the assumptive models surrounding grief and loss and challenges those very models. Rebels are not afraid to question established structured and forms. And yet at the same time, I believe rebels respect the right of others to use different models of understanding and attempt to provide leadership in ways that empower people, rather to in any way diminish them. So I invite and I encourage you to learn about other models of helping people experiencing grief, while at the same time inviting you to reflect on the model I share with you here. So now allow me the honor of exploring the distinction between treating and companioning. The word treat comes from the Latin root word tractor, which means literally to drag. If we combine the word patient with that, we can really get in trouble. Think about it, treat patient, because patient, look it up in Webster's, it's right there, literally means passive long-term sufferer. So if you treat patients, you drag a passive long-term sufferer. Simply stated, that's not empowering. That doesn't fit with my experience at all in what ultimately helps someone integrate loss into their lives. So in my grief counseling philosophy, in lieu of the word treat, over the years, I have used the word companion. When broken down into its original Latin root, it means messmate, com for with, pan for bread, someone you'd share a meal with, a friend, an equal. It's always struck me that there's nothing more co-equal in life than death, and therefore it calls out for co-equal caregiving models. I've taken the liberty, as you'll note, with the noun companion and made it into the verb companioning because it so well captures the type of counseling relationship that I support and for which I advocate. In fact, it's that very image of companioning, sitting together, being present to one another, sharing, staying for the cup of coffee, if you will, communing, abiding in the fellowship of hospitality. I've always found it interesting. Henry Nouwen, I think, beautifully in the helping literature years ago, he described all helping relationships begin in the foundation of hospitality, and he defined that as a shared space where a stranger can enter and become a friend. At a foundational level of caregiving, hospitality, I believe, must also combine with places of sanctuary. And we can define sanctuary as a place of refuge from external demands. It's a space where the mourner can be free to disengage from the outside world, a place where the need to turn inward, to suspend, will in no way be hurried or ridiculed or shamed. There's risk for that because myself and other authors have termed us a fairly mourning avoidant, emotion phobic culture. No, my friends, we need places of hospitality and sanctuary. Companioning people in grief is therefore, it isn't in any way about assessing or analyzing or fixing or resolving another human being's grief. Instead, it's really about being totally present to the mourner, even being a temporary guardian, if you will, of their soul. The companioning model of grief care, it's anchored in a teach me perspective. It's about learning, it's about observing. In fact, the meaning of observance comes to us from body of work and ritual or ceremony. And it means not only to watch out for, but to keep in honor, to bear witness. The caregiver's awareness of this need to learn is the essence of true companioning. Yes, there's an obligation to learn what I like to call a mysterious body of knowledge surrounding grief, but to never think you've arrived and become some kind of grief expert. Because let me remind you, the true expert's the mourner. They teach me, and then I can create a care plan, not a cure plan. And now it's my privilege to introduce to you my 11 tenets of companioning people in grief. Companioning is about being present to another person's pain. It is not about taking away the pain. Companioning is about going to the wilderness of the soul with another human being. It's not about thinking you're responsible for finding the way out. Companioning is about honoring the spirit, the life force. It's not about focusing on the intellect. Companioning is about listening with the heart, the well of reception, if you will. It is not about analyzing with the head. Companioning is about bearing witness to the struggle of others. It's not about judging or directing those struggles. Companioning is about walking alongside. It's not about leading. Companioning is about discovering the gifts that come with sacred silence. It's not about filling up every moment with words. Companioning is about being still. It is not about frantic movement forward. Companioning is about respecting disorder and confusion. It is not about imposing order and logic. Companioning is about learning from others. It's not about teaching them. And companioning is about compassionate curiosity. It is not about expertise. A central role of the companion to mourners involves the art. And yes, I emphasize art. We combine science and our understanding of grief and remind ourselves that caregiving originated from the art of honoring stories. Stories of love and loss where the mourner can say hello on the path to goodbye, can be in the dark on the pathway to light, and honor the instinct to go backward before in any way, trying to go forward. Honoring stories requires that we as care providers slow down and we deeply listen as people in small doses acknowledge the reality of the death, embrace the pain of the loss, shift relationships from interactive presence to appropriate memory, search for continued meaning in their lives and in their living and in their loving. My hope is that this introduction to the companioning model of grief care is something that might well resonate with you. I also hope that you will consider joining us for some of our trainings that we offer at the Center for Loss and Life Transition. Again, thank you so much for joining me for this brief but important introduction to the companioning model of grief care.